Hello, thanks for stopping by. Things are about to become very clear. That is, this is a 2022 Medicare Advantage Clarity presentation. I'm going to go ahead and get started and share this information with you. My name is Tom Basie. I left my phone number and email address there. I'm here to help. Please reach out to me if I can answer further questions. Anything comes up that I don't already cover here. I'm licensed in multiple states in the U.S., but not every state. But the good news is this information will be representative of something near you if you don't live in a state where I am appointed that this covers. So here's the agenda for today. Understand Medicare choices, cover briefly eligibility and enrollment in Medicare, talk about the advantages of Advantage plans. I will spend some time on prescription drug coverage. I will show you some specific Medicare Advantage plan information, 2 or 3 plans laid out side by side to kind of look at the differences between them. Talk about how an agent like myself can be of assistance. I will remark on why you should consider United Healthcare perhaps as a partner in your journey, and then I will share a little bit about some additional resources that can be made available to you. Okay, the beginning, step 1 of the Medicare 2-step is get Medicare. This is a red, white, and blue card. It comes from the federal government, and that's the thing. Part A and Part B are the 2 parts of the alphabet soup that you get from the federal government. Part A approximately is hospitalization. Typically, that's paid for if someone works in the U.S. and they're taking FICA tax out of your paycheck, getting both Social Security and Medicare out of there. Part B is outpatient, doctors, testing, anything done not in the hospital, healthcare provided outside of the hospital. That's Part B. So Part A and Part B. Part B for most people, or for many people in 2020, is actually $170 a month to get that. So typically Part A is paid for. Part B costs around $170 for most people monthly, and that's you get Medicare from the government. Now, having said that, step 2 here, you have 2 options. This first option was the only option around from the 60s, mid-60s to around the beginning of the new millennium, and that is you get a Medicare supplement and you add a Part D. Think of D as in drugs, prescription drug plan. When you hear the phrase Medicare supplement, it does not include drug coverage. So you can get a Medicare supplement, as the name implies, to supplement your Medicare coverage from original Medicare, and then you can add Part D, or you can do option 2, which is to get a Medicare Advantage plan. It actually has Part D included in it. C is the Medicare Advantage plan. So CD together is Medicare Advantage. That's what we're going to talk largely about for the rest of the time today. It's only been available for the past 20 years or so, but it's a nice something to do once you have Medicare. So remember, Medicare, get your Medicare from federal government is step 1. Step 2 is decide which of these 2 options, option 1, option 2. We'll be covering option 2 today a little bit more. Okay, now to get Medicare, typically it's someone who's 65 years old. There is an exception. That is, for example, if you get disabled earlier than 65, often it's about 24 months after disability, you can get on Medicare. The other thing is typically it's a U.S. citizen. Well, it's not exclusively U.S. citizen. Actually, if you've lived in the U.S. for 5 consecutive years, then you're potentially eligible for Medicare as well. So as a general high level, it's 65 U.S. citizens, not always the case though. Having said that, there's an initial enrollment period. It's 7 months long. The month that you turn 65, there's actually 3 months on either side of that as well that make it the 7 months. So if you're turning 65 in December, well, then actually 11/10/9, you can actually start Medicare 3 months before that in September. I'll remark about this once. You don't have to enroll in Part D right away, but there's a penalty of 1% of the average monthly premium for each month you delay enrollment. So I'm not a proponent of delaying. I'm a proponent of going and getting some kind of coverage to avoid that penalty. So in addition, there's a couple other things. In addition to your additional enrollment period, there's something called AEP, October 15th to December 7th. During that time, you can add, drop, or switch your Medicare coverage right there towards the end of the year. Now, there's actually something called Medicare Advantage open enrollment period, which is the first quarter of that year. If you're already a member of a Medicare Advantage plan, you can disenroll or switch to a different one time only change. So in addition, let's say back per my previous scenario, if you got in here in September, well, then actually there's another one mid-October to December, and there's even another one. So periodically throughout the year, you can make changes if you need to. In addition, actually, there's a special enrollment period. If one of these 4 things occur, actually, anytime during the year, then there's a special enrollment period. You could actually make a change. If you retire and lose employer coverage, well, then you get the special enrollment period. You could get an Advantage plan, for example. If you move out of the plan service area, if you had enrolled in some Advantage plan in September for my previous scenario, and in April of that year you move, well, there's a special enrollment period because potentially you're out of network, for example, for the plan you enrolled in. If you qualify for extra help, which is financial support from the federal government, if you get qualified, then there's a special enrollment period. You may be eligible for certain specific Advantage plans for that. And then similarly, chronic health conditions. Maybe you get diagnosed with diabetes or heart disease or certain chronic health conditions. There's a special enrollment period upon that diagnosis. So messages, there's all different times when life may require you to make a change, and you're allowed to make a change to your Medicare options at that time. The advantages of Medicare Advantage. I also call these compelling statistics. 27 million people enrolled in an Advantage plan as of May of last year. That means a lot of Americans are using Advantage plans. 93% are satisfied with that Advantage plan, and and then 25% less is what the cost is. So typically you can save 25% compared to original Medicare. So to me, there's a three big compelling reasons to consider an Advantage plan as your solution. Okay, this is original Medicare right here. This is an Advantage plan. Both of them have these first three checks: coverage for hospital stays, we'll call it approximately Part A; coverage for some medical, like doctor business, and preventative services like flu shots, it's approximately Part B. So it's a thing. Original Medicare and the Advantage plan have those components the same. Where there is no coverage on these next four, but there is some coverage potentially on an Advantage plan, is prescription drugs. Original Medicare doesn't cover that. Routine vision, routine hearing, at least an exam, that's also not covered in original Medicare. And then a limit on your out-of-pocket costs. Actually, a Medicare Advantage plan has an out-of-pocket maximum. There is no out-of-pocket maximum on Medicare. So potentially, if you're having a rough year healthcare-wise and you keep going to get hospital and care, your costs will continue to increase. So those are nice comparison of the two. So Medicare Advantage has the stuff that Medicare has, and then some. Okay, I'm going to step through this top 10 just because I don't want to forget to mention these benefits to you. These are top 10 things you should know, I should say. Number one, you do have to continue to pay the Part B premium. Even if your Medicare Advantage plan is $0, that's great. You don't have to pay anything to that carrier for that plan, but you do have to keep paying the government your Part B premium in order to be eligible to sign up an Advantage plan. Medicare Advantage has you covered. That's kind of a nod to that previous screen where I showed it has the stuff that Medicare has and the same ones, and it has some additional stuff. Joining a Medicare Advantage plan may affect your current coverage. The classic example, we kind of talked about the SCP, special enrollment period at work. Actually, if you turn 65, you can go ahead and switch over to Medicare instead of your employer's insurance plan. So that's something you can do. You would drop the employer's plan, add Medicare instead. It's best to use network providers. Don't use BEST a lot in this industry, but I can use it here, and that's because in-network costs less than out-of-network always. And so it is best to use network providers because you will save money. You may qualify for financial assistance. I've remarked about that a couple of times. Extra help from the government. Actually, at the state level, Medicaid, there's some fine resources available to people who are struggling economically. I mentioned this once, but it merits saying again. If you enroll in Part D late, you may pay a penalty. Part D, if you will call this drugs. So my point is, if you're starting Medicare, make certain you get some kind of drug coverage in place to avoid the penalty. A Medicare supplement insurance plan, also called a Medigap policy, is not a Medicare Advantage plan. That's option one versus option two. They're two different animals. It's good to understand the difference between the two. Keep your member card handy. That is a Medicare Advantage plan. If you enroll in a Medicare Advantage plan, you can actually leave your red, white, and blue Medicare card at home, but you carry around that Advantage plan with you, and you carry it to the doctor, to the pharmacy, to the prescription, to the ophthalmologist, to the dentist, anywhere that your plan has coverage. You carry that thing and you use that and say you can leave a Medicare card at home. Medicare Advantage offers the same protections as original Medicare. It's that column. They have the same and then some. And then you have a built-in financial safety net. That's a reference to the out-of-pocket maximum. There is no out-of-pocket maximum on original Medicare, but with a Medicare Advantage plan, there's an out-of-pocket maximum. $4,000, $8,000, whatever's the least you know. With the plan you've got, you will not spend more than that annually on your healthcare. Beyond that, the plan will cover everything else. Okay, I'm going to spend a little time about this because it's a point of confusion. Prescription drug coverage, understanding the drug payment stages. There are 4 stages. And so that's why my most common question about drugs is, how come I have the same drug or drugs and I go to the same pharmacy and it costs different amounts during the year? Well, this is why, because there's 4 different stages. There's the annual deductible stage, there's the initial coverage stage, there's the coverage gap, also known as the donut hole, and there's catastrophic coverage. Depending on where you are, you're paying different amounts. A deductible, you pay all of it. If there's a deductible, and some plans have deductibles, some plans only have it on certain tiers of drugs. But bottom line is, if you have a deductible, you got to pay that first before your plan starts kicking in. So you'll pay 100% if you have a deductible. Once you're in deductible, then you pay a copay or a co-insurance. And you stay in that phase until your total drug costs, not what you pay, but what the cost of the drug is, which is a combination of what you pay and what the plan pays. When that exceeds $44.30, then you're in the donut hole. You will stay in the donut hole, and during that time, you have to pay 25% of your drug costs instead of your copay until your drug costs, again, exceed just over $7,000. Once you see $7,050, then you're in the catastrophic phase. In the catastrophic phase, you will only pay either $3.95 for generic or $9.85 for the other drugs, or 5%, whichever is greater. And so I'm going to make up an example. Say I have one drug and it costs $1,000, but my copay is only $100 on that drug, and there's no deductible. So I'm not in deductible right away. January, February, March, and April, then I only pay that $100. The plan pays the other $900. Once I get into May, because I've exceeded this, oh no, instead of paying just my $100 copay, I now have to pay 25% of my drugs. So in May, June, July, I'm paying 25% of that, or $250. So for that same drug, I paid initially $100, 25%, I paid $250. Then once I'm in August, month 8, I've actually exceeded the total out-of-pocket cost here. Well, now I'm only going to pay 5% or $50. So I selected those numbers to make the math easy, but basically my point is I paid $100 for a while, it was an initial coverage, then I paid $250 because of the coverage gap, and then I paid $50, and that's because it's 25% and 5%. That's the way that works. So a single drug or a set of drugs at a single pharmacy, you'll pay different amounts during the year if you can move through these phases. If you only have a couple of if you have a $0 deductible, and if you have a couple of low-cost medications, you'll never even get beyond deductible or initial coverage. Perhaps you'll just your plan may pay for it, and the total cost will likely never exceed that. So you just stay in initial coverage the whole time. That's the way that works. Okay, a couple other things to reiterate: total drug cost. That is the cost that you pay and the cost that the plan pays. So in my example, I was paying $100. The plan was paying $900. The drug cost was $1,000 total, and that's what you use to determine what stage you're in. And then out-of-pocket costs, well, that's any deductible that you have to meet, and it doesn't include what you pay or your premium that you have, but it's the cost of the drugs. Out-of-pocket drug costs, not premium, and it's out-of-pocket. Okay. Pharmacy, it's important to remark on these things. And United Healthcare Advantage plans, there's over 65,000 pharmacies that are in network. If you'll go to in network, you will save money. You can also save money in a retail pharmacy. So 2 different ways to save on medication is go to in network retailers and or to use mail order. The drug list, every plan has a drug list, but not every single drug in the world is on that list. But the list of drugs that are covered, it is called the formulary. And in the formulary, there are tiers 1 through 5. Tiered or preferred generic drugs, tier 1, I should say. Tier 2 are generic drugs. Tier 3 are preferred brand name drugs. Tier 4 are non-preferred drugs, and tier 5 is specialty drugs. And I suspect you can guess, as the tier goes up, the higher the copay, the higher the cost of these drugs are. But there's always a formulary listed of what plans are covered, and there's always tiers to determine the copay on it. Couple more things to understand when we're talking drugs. Step therapy is when you try a lower cost medication to try to treat a condition, and then step up if the lower cost isn't having the desired effect. Quantity limits, as the name applies, is sometimes there's only a certain amount someone can get, or a certain amount of days. And that's to ensure that the drug is used safely, not abused. And then prior authorization, sometimes a prescription will not be filled unless the prior authorization is given by a physician to allow that drug be used. To make certain the drug's used correctly, and you may be required to try a different drug. Okay, you can ask for an exception. You can ask for an exception, a formulary exception. If it's not on the list, you can ask, hey, can you guys cover this thing? That's formulary exception. Or utilization. If somehow you need some additional amount or additional days, you can ask for utilization exception. In each instance, a coverage decision, if the doctor submits it on your behalf, generally it'll be decided within 72 hours. It can even be expedited potentially if the doctor determines it's medically urgent. So you can get exceptions to the formularies. Okay, now what I'm going to do is I'm going to go ahead and compare 3 plans close by each other. They're all offered in the North Dallas area, and I'm going to lay them side by side so you can see the differences in these plans. Just take a look and see how Advantage plans vary across plans. These are from the same carrier. Think about which one you might choose. Look at the features that are here and see which one you like the most. I'm a proponent of getting the plan that's the most comfortable that you like the most. Take a look at these. Plan 1, Plan 2, and this was just called Advantage Plan. Okay, we're going to compare all 3 of these. The premium is $0 for the 2 on the outside. In the middle, it's actually $73. So this is a $0 premium and a $0 premium. This one is a $73 premium. What happens is the one in the middle will have lower copays and or higher benefits. Plan 1 and Advantage plans are quite similar. I might describe the Advantage plan as a new version of Plan 1. They're similar. There's some differences, and so you can consider which one of those 2 you want there. But we'll take a look at differences. And Plan 2 is, as I implied already, you pay something for that, but you'll have lower copays and higher lower out-of-pocket maximum and higher benefits. So annual deductible, medical deductible, $0. These are 0 deductible plans for Medicare coverage. Primary care visit is $0 for all 3 of these. Specialist visit, it does cost $20 less than Plan 1 on this paid plan, but actually so does the other $0 plan. Is a referral required? These are all 3 HMO plans, so yes, the referral is required to go to a specialist. Preventative services all have a $0 copay. Now, here's the first big significant difference between these plans. Plan 1, if you go to a hospital, $250 a day per days 1 through 5. Then it drops to 0. The new plan, which had the lower specialist cost, actually it's $325 a day for days 1 through 5. Then it drops to 0. That Plan 2, where you're paying the premium for it, $73, it actually only has a $150 copay. That's it per admit. That's all you got it in. So it costs less. Hospital stay costs less on the premium, the plan with the high premium. Skilled nursing facility is the same price on all 3 of these plans. The outpatient surgery, this is an and or. It'll either be covered or not. If you go to you can plan on the most expensive one. So this just has a $150 copay. This one has a $225 copay. This one has a $275 copay. So an outpatient surgery has potentially the lowest copay is on the paid plan. I think you'll start to get the gist of how that's working. Diabetes monitoring supplies are $0 on all 3 of these plans. Home health care is $0 copay on all these plans. Diagnostic testing is $20 or $25 for that plan. Lab services are $0. Ambulance $265 either way, ground or air on all these plans. There's not a lot of difference there. But here's the thing: out-of-pocket maximum $3,900 for the 2 outside plans. Where the plan you're paying them up it's $3,200. That out-of-pocket maximum. So if you're going to be in the hospital and have a lot of care during the year, the out-of-pocket maximum on this plan is only $3,200. On the other 2 plans, it's $3,900. I'm not going to spend a lot of time on this, but this is basically the pricing of the medications. Let's see here. Yeah, there's very little. So you can see there's a $2 copay on this one where it's $0 on the plan 2. Actually, this one has a lower copay for tier 2 drugs than even the paid plan. So, but they're pretty close. There's not a big significant difference here on those plans. The biggest difference between these 3 plans is the copay for a hospital stay and the out-of-pocket maximum. That's really that's what I'm illustrating to you here. Now here's some benefits. Dental coverage. Plan 1 has $1,000. Plan 2 actually has $1,000 only. Plan 3 actually has $1,500. So if the dental is most important to you, maybe take a look at that one. For routine vision care, they all 3 have a $0 copay on an annual exam, but the 2 outer plans have $100 where you're paying the monthly premium. There's actually a $200 eyewear allowance. Oops. For hearing coverage, $175 is the copay. Actually, for the plan that had the more dental, actually has a higher copay for hearing aid. It's a $375. All 2 of these have a $40 over-the-counter credit. Actually, you get a $45 over-the-counter credit on the new plan, the Medicare Advantage plan. All these have Renew Active, which is a wellness plan that includes typically a $0 gym membership in a gym near you. And then for this particular one, Actually, these two do not have post-operation meals. This new plan has 28 post-operation meals for 14 days, as long as you were admitted in hospital stay. So they'll provide a post-operation meal. That's a nice feature. So those plans are provided in basically the North Texas area. All three of them are there. My message to you is, no matter what state you live in, there are probably some plans that advanced plans that work like this by United Healthcare. So up as we went through these things, you can understand how they might differ, and you understand what to take a look at when you're considering your Advantage plan options. Having said that, I'm here to help. Reach out to me. You've got my email address and my phone number. I'll show it here again at the end. If you need help see if doctors or specialists or hospitals in network, I can help you take a look at that. Prescription medication, I can plug those in and show you which tier they're in and show you the pricing that can be expected on your drugs on a given one of these plans. I can help you find a gym near you that takes a Renew Active if you want to go there for $0. I can provide some guidance on how you can check for example, if you're eligible for both Medicaid and Medicare, there's some feature-rich Advantage plans that service people that have those challenges. And then some, actually, if you are a veteran, if you have TRICARE for life, there's some plans. There's a plan by United Healthcare called Patriot that plays well with VA. So you can get some of these same benefits, even though you've already got TRICARE, and I can help you take a look at that. A little bit about United Healthcare. They've been serving Medicare community for over 40 years. More people choose them than any other provider for their Medicare journey along in the U.S. And they are really dedicated to helping people live a healthier, happier life. I hope that was evident to you. It's not just health insurance, medical health insurance. They've got benefits in there as well, be it the nurse line, be it a Renew Active. They really are committed to helping you live a healthier, happier life. These are some additional resources that can be made available to you. Medicare Made Clear might be considered a brochure that kind of has some of this same information in it. Medicare Helpline, you can actually dial 1-800-MEDICARE and talk to someone there. Medicare and You is a big, thick book that the U.S. government provides to Medicare eligibles. Online plan finders, you can literally go online and take a look at which one is near you and in your zip code. I can help you find that. State resources, I can help you find out. For example, if you want to apply, if you think you're close to Medicaid eligibility, if you're having financial issues, I can help you. I can point you in a direction, help you apply for that. I can help you get a login at Social Security. I won't do it for you, but I'll show you and help you how to get help with Social Security. Some people pay for their Medicare Part B, for example, by taking Social Security at the same time. That's an option. And then actually, elder care locator. There's if you need to find a place that provide home health care, I can help you find one that's in plan. So consider me a resource. There again, that's my name, Tom Basie. My phone number. I'm most easily reached at email, tom.basie@gmail.com. I thank you for stopping by today, and I hope this has been beneficial to you.